if you are unfamiliar with the term token economy, you are familiar with the concept. Every day you participate in an elaborate token economy, which is our monetary system. In this lecture, we will review token economy. What is a token economy? And a step-by-step guide in designing and implementing an individual token economy. We will also review the behavioral parent training. Okay, so a token economy is a system of motivating clients to perform desirable behaviors and to refrain from performing undesirable behaviors. Clients earn tokens, which are the token reinforcers, such as poker chips or points, for adaptive behaviors and lose tokens for maladaptive behaviors. In other words, they receive poker chips or points when adaptive behaviors are positive behaviors that you want, and they lose tokens for maladaptive behaviors, which are the unwanted behaviors. The clients exchange tokens for actual reinforcers called backup reinforcers. Clients are made aware of what they have to do to earn or forfeit tokens and how they can spend them on backup reinforcers. Okay, let's go over some basic elements. A token economy consists of 4 basic elements. 1. A list of acceleration and deceleration target behaviors, including the number of tokens that clients can earn or lose for performing each. Token economies primarily deal with accelerating target behaviors that vary with clients' problems. For a 10-year-old with intellectual disabilities, dressing might be a target behavior, whereas for a 10-year-old 5th grader with attention deficit hyperactive disorder, completing an assignment might be a target behavior. Second, a list of backup reinforcers, including the token cost of each. The list of backup reinforcers is general for all the clients in the token economy, and it includes reinforcers that will motivate each of the clients. Third, the type of token. Tokens can be tangible or symbolic. Tangible tokens include poker chips, for example, having different colors for each different value. Metal washers, especially designed paper currency, stickers, stars on a chart, and money itself. Points are symbolic tokens. And fourth, specific procedures and rules for the operation of the token economy. For example, indicating when clients can exchange tokens for backup reinforcers. Such rules are crucial when a small staff must administer the program with a large number of clients. Token economies are used to treat diverse problem behaviors and client populations of all ages and intellectual capacities, such as ranging from simple self-care skills to complex interpersonal problems that develop in marital relationships. Token economies are also used in group living situations, in hospitals and outpatient facilities, and in work environments. Patients with psychiatric disorders, juveniles in trouble with the law, training individuals with intellectual disabilities, in the classroom, and it is used at home. Token economies have been used in preschool, elementary, and secondary classrooms across all levels of education, special education, remedial, and mainstream classes. teachers have focused on classroom conduct and academic performance the most. Now, let us work together in designing and implementing an individual token economy for a child. This exercise provides directions for setting up a simple token economy to motivate a child to complete everyday chores. Ready? Okay. Step 1. List 4 chores that must be completed. Higher point value in 5 days. So on your sheet of paper or chalkboard, I want you to write 4 chores that must be completed by the child. That is not enjoyable. Then list 2 fun chores that is optional with a lower point value. Step 2, choose 4 activities, and I want you to rank them in order from best to worst, matching the point value chore that the child enjoys. So the activities, the child must enjoy them. For example, watching TV, going out for ice cream, going to the beach, etc. Step 3, establish a baseline by placing a check mark for every chore completed and on what specific day completed. You must begin on the same day each week. Step 3. After 5 days of the token economy, add the number of points after each completed chore. If the token economy was effective, the child would have completed more chores while the token economy was in effect. If this did not occur, you may have to increase the point values earned for each chore or select some more enjoyable backup reinforcers. Now let us review behavioral parent training. 1/3 of all referrals of children for psychotherapy involve non-compliance with parental requests and rules, as well as disruptive behaviors, such as aggressive acts and temper tantrums. When such behaviors occur occasionally, as they do with most children, they are considered normal. They're growing pains or just a stage that the child is going through. However, when they are frequent, long-lasting, or intense, parents appropriately may seek professional assistance. One approach to dealing with children's non-compliant and disruptive behaviors is for the child to receive individual therapy. However, around 1960, it became clear that traditional psychotherapy with children exhibiting such problems were largely ineffective. These observations led to 2 prominent behavior therapists, Patterson and Forehand, to develop behavioral parent training. Now, this is also called behavioral child management training and parent management training, to teach parents behavior therapy procedures to effectively manage their children's behavioral problems. The primary goals of behavior parent training are to increase parents' use of 1. Clear, direct, and age-appropriate instructions to the children. 2. Consistent reinforcement for pro-social, desirable child behaviors. And 3. Consistent and appropriate punishment for children's non-compliant and disrupted behaviors. Positive reinforcement, including differential reinforcement and time out from positive reinforcement, are the major therapy procedures that therapists teach parents. They may also teach parents to use contingency contracts, home token economies, and response cost. So parents initially learn to notice and reinforce their children's desirable behaviors. They are taught how to differentially reinforce behaviors that compete with serious undesirable behaviors, such as hitting their brothers or sisters, and to extinguish, which is by ignoring, minor undesirable behaviors, such as whining. Parents learn to give clear-cut instructions calmly and to refrain from angry, indirect, negative instructions. Planned activity scheduling is another procedure taught in behavioral parent training. Parents learn to change certain events in anticipation of their child's behavior problems to prevent the problems from occurring in the first place. Behavior parent training is conducted with a single family or in small groups containing about 4 to 10 sets of parents. Parents rehearse the behavior therapy procedures in the training sessions and receive feedback from the therapist. Child behavior problems include non-compliance with instructions and rules, oppositional, aggressive, and antisocial behaviors, Asperger's syndrome, ADHD, childhood sleep problems, separation anxiety, eating behaviors, and completion of homework. Behavioral parent training is more effective when administered by trained mental health practitioners than when parents learn the procedures by following exercises in a workbook. Behavioral parent training can result not only in children becoming compliant with their parents' instructions, but also in their becoming more compliant than children who have no significant behavior problems. The positive effects of behavioral parent training are consistently maintained over time, as demonstrated in follow-up studies ranging from 4 to 10 years. Training for dealing with one child sometimes decreases problem behaviors of their siblings. In my next lecture, we will review exposure therapies. They are used to treat anxiety, fear, and other intense negative emotional reactions, such as anger, by exposing clients under carefully controlled and safe conditions to the situations or events that elicit the emotional reactions.